Hello, I'm Dr. Lica, specialist dermatologist, regenerative medicine expert, and I'm welcoming you to our podcast about longevity, regenerative medicine, and biohacking. And today we increasingly hear about peptides. They are called the molecules of the future, a tool of anti-aging medicine and even an alternative to traditional medication. But for many people, this sounds complicating and intimidating. Today we will figure out what peptides are, how they work, whether they can truly slow down aging. And today's guest at my podcast is Dr. Alla, functional medicine and regenerative medicine doctor. And let's start from the basics. So Dr. Alla, what are peptides?
So basically peptides are very short chain of amino acids that you naturally can find inside with our body. And when we're talking about the longevity, one of the hallmarks of longevity, it's a loss of connection between the cells. And this is the role of peptides. So they are targeting molecule that send a signal to the cell how to work, how to activate, and how to produce their function.
So peptides are not something foreign to the body, but substances our body naturally uses?
Exactly. Most of the peptides you can find inside of the body, but some of them, of course, synthetic. So, for example, we have a BPC-157, and you naturally can find it inside the gut. Mm-hmm. It's produced by stomach to protect the gut lining from the gastric acid. We have a thymosin beta that you can find by the thymus, and of course all of them very essential for all of us.
Why do people talk about peptides so much right now?
Basically what we have to understand that peptides is not something new. We know about peptides for the long time. The first peptide that was synthesized in the market actually was insulin, that all of us know about. But recently when we shift our medicine from the disease-oriented pattern to patient-oriented pattern, we started to learn how we can personalize our treatment, not only cover the symptoms, but exactly to address the root cause. And from this point of view, peptides become a very useful tool. Now with the peptides, as they are targeted molecule, we can slow down aging process, we can support the gut healing, we can basically support the recovery and also stimulate the production of the collagen in the skin, we can help with the hair growth. But what the most important, peptides able to slow down the biological age. For example, we have epitalon that increase the length of telomeres, so it's exactly tailored for that.
So medicine is gradually shifting from treating symptoms to restoring body functions?
Absolutely. So we now facing the pivotal moment in the history of the medicine. As before we're focusing on the lifespan, now we focus on the health span. So our target is not increase the longevity, but also improve the quality of life.
Dr. Alla, how peptides work?
So this is a very interesting question. What we have to understand that peptides like the messenger between the cell. So depends on the type of the peptides, we can reach different goals. We can stimulate the cell, we can support the release of the hormone, and based on the function, now we have around 7 to 8 different groups of the peptides. We have regenerative peptides, we have immune peptides, we have antibacterial peptides, we have healing peptides, immune peptides, and basically peptides that was initially synthesized to slowing down the aging process in the body.
So they don't force the body to work, they remind it how to function properly?
Exactly.
And which peptides are the most demand today?
So now we have a very well-known group of the peptides. Maybe most known one is a CGC ipamorelin. It's a combination of two peptides. One of them is a growth hormone releasing hormone. Second one is a growth hormone releasing peptide. And this combination gives us ability to help release the growth hormone from the hypophysis and maintain a healthy level in the body. And as we know, the growth hormone is a longevity organ. Unfortunately, with the age, we started to lose this hormone, but peptides help us to repair it. And it will stimulate the healing process, it will help with the circadian rhythm, it will help to build muscle mass, and of course, it will help to stimulate the collagen production. Another well-known peptide, it's a BPC-157. From one side, it will help to heal the gut. From other side, it will also help to healing the different injuries, but it also will stimulate the nitric oxide production, so it will fight with the hypertension, erectile dysfunction, and plus it will push the calcium inside the bone, so it can be a very useful tool in the treatment protocol for osteoporosis. Another, maybe one of the most interesting peptides will be MOTS. This is a mitochondria peptide. So what we know, every cell inside the body has a small organelle called mitochondria that produce energy. Again, with the age, this is the hallmarks of aging, we started to lose the amount of the mitochondria, and what's the most important, the quality of the mitochondria. MOTS help us to stabilize the mitochondria and stimulate the production of ATP.
So it's not a universal youthful pill, but it targeted work with the body's specific needs?
Of course, even peptide therapy considered very safe, we still have to select the patient, and it will help us also to prevent the complication. Peptides safe, natural, but it doesn't mean that they for everyone. As any coin has a two sides, peptides has their benefits, but also it has their own side effects and of course the contraindication. So we have to very carefully select the patient for the peptides.
So in what cases can peptides be beneficial?
They help us to repair the healing process. They help us to restore circadian rhythm. They help us to stimulate the collagen production. They help us to slowing down the aging process. And of course, they help us to feel the better version of ourselves. So peptides very useful, but again, we have to keep in mind that they supposed to be personalized.
So it's not only about anti-aging aesthetics, but also about quality of life and energy. And are peptides safe?
If they selected correctly. So before you will start, even before you think about the peptide therapy, you always have to check where is our starting point, and if the patient is suitable for this kind of the peptides. Because yes, peptides safe, but they have side effects. They can trigger the cancer growth. They can maintain the inflammation. They can disrupt the circadian rhythm. They can destroy the mitochondria. So it's very essential to do some initial lab test before starting with the peptide therapy.
So the key words are personalization and of course medical supervision.
Exactly.
Dr. Alla, can peptides really slow down aging?
Actually, what we have to understand that our target is not increasing the lifespan, but improving quality of life, and this is what peptides can do. But again, we have some kind of peptides that can able to impact on the hallmarks of aging. I'm talking here about the mitochondria peptides. Now we have FDA approved peptides SS31, we have a MOTS. There is a group of peptides that able to calm down the oxidative stress inside the body, for example, well-known glutathione. We have a peptides that able to increase the length of telomeres, epitolone. We have gut healing peptides. So basically we can find a group of the peptides for any single hallmarks of aging. So yes, it can improve the quality of life and of course the lifespan as well.
Yes, this is what really all of us need. So youth is not about age, but about the condition of your cells. Dr. Alla, who should consider peptide therapy?
Be honest, it's more easy to tell who not supposed to consider peptide therapy. We don't prescribe peptides for our pregnant patient, for our lactation patient, and of course for active cancer patient. Of course, if the patient has any complaints, we can use the peptides, not like isolation molecule, but as a part of the protocol to help patient to reach their treatment goal.
So this is a part of conscious approach to health, not just trend. And the main takeaway for the listeners?
Peptides amazing if used correctly. So the main idea here, this is a medicine and this is a real treatment. So it has its own benefits, side effects and contraindication. Always personalize your approach to the peptides and always check with your healthcare provider which peptide is more suitable for you.
Dr. Alla, how we can guarantee that peptides therapy will be safe and effective?
So first of all, peptide therapy is supposed to be prescribed by your physician. So he from the beginning rule out your side effects, possible side effects and contraindication. The second one, always use the products from the licensed compound pharmacy, not from online stock and for research only. And the third one, of course, transportation makes sense. So peptides are quite fragile, so light, heat, shaking, they quite easily destroy them. So make sure that you keep peptides safe in the fridge, don't shake them and only roll, and of course use a guaranteed provider. So the future of medicine is not about fighting age, but about supporting the body's ability to regenerate. So if you're a doctor and want to know more about peptides, then join our CPD Peptides module and check the link in description. Dr. Alla, thank you so much for our nice conversation, and we'll be happy to see you again at my podcast. Thank you so much.